Sawasdee krap. Good afternoon once again. Today is Wednesday, the 9th of June, 2021, and this is the English language summary of the daily press briefing here at the Center for COVID Situation Administration, or CCSA. Of course, we're on the second day of our national vaccination, mass vaccination campaign, which is a national agenda. There is a long way to go. And when we actually reach the day that we do not have to face with the challenges of COVID, we'll also, of course, be focusing on building confidence in the economy of Thailand, hoping that will be true in the near future. Thank you very much to Dr. Pisamai for the Thai language summary we heard just now. We also heard a short briefing by Dr. Chawet-san, who is a director at the Department of Disease Control dealing with emergency diseases. Now I'll start off first with the vaccination progress and the general numbers and cases that we have, and then I'll summarize a bit of the briefing of Dr. Chawet-san. So first of all, to start off with the update of the number of vaccines that have been administered since the 28th of February 2021. So once again, like yesterday, you see this screen, this infographic on screen for you. It's all in blue and light blue. The first column that you see in the lightest blue is the number that we have vaccinated on the 8th of June 2021, or yesterday alone in one day. So on the second day, we had over 400,000, which according to this pace at the rate that we are going, it is a very good sign that we will be reaching our target of inoculating 10 million people in the month of June. The second column is the cumulative one. It's only been the second day, so the first day was, as you recall, 400,000 plus. The second day we have 472,000 plus, so that is the total for 2 days, and we'll keep on having this number in terms of the cumulative number since the 7th of June 2021. The last column on the right, as you see, 5.1 million. That is the cumulative number of vaccinations so far since the 28th of February, which is the soft launch, which is the emergency vaccination of medical personnel and the like. So cumulative, now we have 5.1 million doses. And to accelerate this vaccination campaign nationwide, the CCSA has yesterday approved and permitted the private hospitals and local administration authorities to procure additional vaccines through designated agencies such as the National Vaccine Institute, the Government Pharmaceutical Organization, and the Thai Red Cross. And under this announcement, the Food and Drug Administration, or FDA of Thailand, is instructed to facilitate vaccine registration requests from manufacturers to ensure a smooth and effective process of procurement. In addition, all government and private agencies are requested to synchronize information as administered by the Ministry of Public Health to ensure systematic and effective information collection. So moving to the general situation, number of cases we have for today. Actually, today is one of the many days that we have recorded more new recoveries than the new confirmed cases. Today in particular is very good because we have almost 2,000 more new recoveries than confirmed cases. We have 4,253, 4,200 plus new recoveries. And we have new confirmed case standing at 2,680, as you see on screen. Now, out of this number, 2,860, there are a smaller number, which compared to other days, we have 280 from the prisons around the country. Now, if you recall, the number of new cases for the past week have had a large portion of it coming from the prisons. Now, this number is getting smaller. We have, unfortunately, 35 new fatalities recorded today, making the cumulative fatalities 1,332. The death rate is still quite low in Thailand. standing at 0.79%. And the active cases still being treated currently in Thailand, stands at 47,644. This is getting lower from around, I believe, 49,000 and 50,000 in the past few days. Hoping that this trend will continue in terms of the number of cases, the number of people being treated and discharged, as well as the pace that we're doing quite well in regards to the vaccination inoculation across the country. So Dr. Apisamai addressed some questions. One was regarding the side effects and regarding the adverse events, and Dr. Chawet San from the DDC also elaborated on that. I'll just touch on this briefly. So firstly, for the Q&A session, Dr. Apisamai mentioned about the 30-minute observation after each jab of vaccines, which is the standard procedure for being vaccinated in Thailand, in whichever site or whichever hospital or whichever scheme that you are being vaccinated in. So 30 minutes of observation, but after that, that's not all. In Thailand, after the observation at the vaccination site, there will be medical personnel following up and calling you to monitor your condition after the vaccination. This will happen around 7 days after within 7 days of your vaccination, as well as 14 days also. The authorities would be looking out and be on alert for any adverse events following immunization. Now, this term is, the acronym is AEFI, so it stands for Adverse Events Following Immunization. That is something that the health authorities will be monitoring and following up on every person who has been vaccinated. Dr. Chawet San, a director in the Department of Disease Control, also elaborated on the general picture of vaccination and the numbers that I had mentioned just now, that yesterday alone, on the 8th of June, we had 472,128 doses, which is a very good number. He also gave us the general picture about the 5.1 million doses so far, as well as the supply of vaccines which are to be used in the month of June, to be increased to around 6 million, added to the 4 million already arriving. So if our inoculation pace goes well, there will be 10 million people vaccinated this month. Dr. Chawet San also talked about the following up and the monitoring system in terms of the people being vaccinated. So it is important to look at the causes of each condition after being vaccinated, or if in the unfortunate case of someone passing away after being vaccinated. It's very important to look into the cause. And some of these, when studying these causes, some might not actually be AEFI, or adverse events following immunization. Some of these might merely be side effects of the vaccination. So side effects is actually not the same as adverse events following immunization. Furthermore, some cases of people being vaccinated may be actually coincidental events, not actually side effects or adverse events. Coincidental effects because of certain conditions, such as heart disease or purulent meningitis, or intra-abdominal aneurysm. These are various health conditions that people might have, and it might cause coincidental events after vaccination. Nevertheless, the process of treatment and the process of autopsy for those who have passed away, unfortunately, is very important. And there is this standard process which the health authorities will be sticking to, and distinguishing actually between AEFI, side effects, and coincidental events to determine the cause of each condition. So that is the level of detail that medical personnel in Thailand have gone into. So thank you for that information from the Department of Disease Control, Director Dr. Chawet San. So before closing today, I'd just like to draw your attention to some useful and important recommendations by the World Health Organization. As more and more of us are vaccinated each day, the World Health Organization stresses that being vaccinated does not mean we are done with COVID-19. We're just more protected while we can still be infected. But vaccinated or not, we still need to keep our guard against COVID, keep distance, wash hands frequently, wear masks, avoid crowds, ventilate and open windows, and clean and disinfect and cover coughs and sneezes. So after I finish my briefing, I'll be asking our team to show us a short clip from the World Health Organization regarding these recommendations. So thank you very much, and thank you for your attention, and please enjoy the clip after I leave. สวัสดีครับ